Lateral hip pain, often called greater trochanteric pain syndrome. This is information for patients suffering from lateral hip pain. Greater trochanteric pain syndrome is a common clinical syndrome that used to be called trochanteric bursitis. It is more common in females on a 4:1 ratio. It's more common in 40 to 60-year-old patients, and it occurs in 10 to 25% of the population. It occurs in 35% of people with lower back pain. Patients usually complain of pain at the side of their hip, which radiates down the side of the thigh and often below the knee. It is often made worse with long walks, sitting for prolonged periods of time, standing, getting in and out of a car, up and down stairs, lying on the painful side, and lying on the opposite side. Lateral hip pain is usually caused by overload to a group of muscles called your gluteal muscles. These are called glute med, min and max. They attach onto the pelvis and also onto the side of your hip bone, which you can feel by your side. Their role is to stabilise your pelvis on functional tasks such as walking and stairs, but also to help you move your hip. As we exercise or perform activities of daily living, we stress and load our tendons around the body. Under normal circumstances, our tendons go through a cycle of stress and regeneration on a daily basis to maintain normal, healthy tendon tissue. However, on occasions, we may repeatedly overload or compress the tendons too often, and there is not enough time for the regeneration process to occur. This is when the tendon then becomes painful and symptomatic. Here are a number of positions during the day that can repeatedly compress the tendons. Try to avoid these aggravating positions or activities for long periods of time. If you continue to overload or compress the tendon, the muscle can become stiffer, tighter, and tender to touch, often referring pain down the leg. Due to pain, you then become less active. The muscles become weaker, and then more simple activities become the overload activity, and so the cycle continues. How can I ease my pain? Exercises to help the muscle switch on and become stronger is the best way to improve symptoms and stop the problem coming back in the future. Often patients are given injections, and for some patients this can help reduce the pain temporarily. This will often not specifically address the root cause of their problem. Often the patient's pain returns a few months later. Try and avoid aggravating positions or activities that may induce compression on the tendons. Try some massage around the hip muscles. If you line your side with the affected hip on the top to see if someone can massage around the tendon area. This will become quite tender initially, but will ease with time. If you imagine your body to be an empty bucket, every activity that you do during the day is the water going in. Eventually, your bucket will reach its full capacity and water will overflow, in this instance being pain. With rest and inactivity, the bucket begins to shrink as our muscle system becomes weaker. When we return to activities, we now have an even smaller capacity and overflow sooner. Therefore, to improve your symptoms further, you need to increase gradually the size of your bucket, or in this instance, the strength and capacity of your gluteal muscles to withstand your loads. Exercise to help the hip muscles switch on and become stronger is the best way to improve symptoms and prevent them returning in the future. Here is a selection of the exercises we use in physiotherapy to help manage lateral hip pain.